Obesity has become one of the most debated topics in modern medicine, especially when it comes to defining whether it should be considered a disease. Many prominent figures like Oprah Winfrey have publicly shared their struggles with weight, emphasizing that obesity is not just about body fat, but involves deeper biological factors. In fact, some experts, including prominent doctors and organizations such as the American Medical Association and the World Health Organization, have labeled it a disease. However, others remain unsure, creating a polarizing divide in the medical community. At the center of this debate is the lack of a clear medical definition of obesity as a disease. Traditionally, body mass index (BMI) has been used as the primary measure to determine obesity. BMI calculates body fat by comparing a person's weight to their height. If the BMI is over 30, a person is classified as obese. But BMI, originally created as a statistical tool rather than a medical diagnostic, is flawed. It fails to account for how body fat is distributed or whether someone is healthy despite their weight. Thus, relying on BMI can lead to misdiagnoses, with muscular individuals being labeled as obese or unhealthy, while those with normal weight may have underlying health issues that BMI overlooks. With new weight loss treatments like Ozempic, which cost over $1,000 per person per month, the debate over defining obesity takes on a financial and ethical dimension. The question is no longer just about labels. It is about who qualifies for treatment and who receives critical healthcare resources. This concern makes it crucial to redefine obesity more accurately. For many years, the medical community has struggled with how to diagnose obesity correctly. Declaring it a disease, as the AMA did in 2013, aimed to improve healthcare access for people with obesity and reduce stigma. The goal was to treat obesity as a medical condition, not a personal failing. Many believed this approach would encourage better insurance coverage for treatments and help shift the blame away from individuals, focusing instead on biological and environmental causes. Obesity rates began to rise dramatically in the 1980s, especially in high-income countries. The rapid increase was not due to a sudden lack of willpower or genetic changes in populations, but rather environmental factors that exploited people's genetic predispositions. These changes made it easier for people to gain weight and harder to lose it. For example, easy access to high-calorie foods, sedentary lifestyles, and other societal changes contributed to this rise. While it might seem logical to label obesity a disease, it is more complicated than that. Excess body fat can manifest in various ways. For some people, fat may be a symptom of an underlying issue, like a hormonal imbalance, while for others, it could directly cause problems. Additionally, people with normal weight can still have dangerous fat accumulation in their organs, known as thin fat obesity or normal weight obesity. These cases make obesity a challenging term to define accurately, affecting over 1 billion people worldwide and costing the U.S. health system around $173 billion annually. The confusion largely stems from BMI's limitations as a diagnostic tool. Dr. Francesco Rubino, an expert in bariatric surgery, pointed out that the misdiagnosis caused by BMI can affect millions of people, making it hard to differentiate between those who need medical treatment and those who are simply classified as obese based on their size. For example, many athletes with high muscle mass are often mislabeled as obese. This leads to unnecessary treatments or emotional burdens for people who are healthy but classified as sick by outdated metrics. On the other hand, people who truly need medical care may be overlooked. Some individuals store fat in their organs, which poses greater health risks than fat stored in other areas, like the thighs. For example, South Asians often store fat in ways that increase their risk for heart disease and diabetes, even at lower BMI levels. But because they do not appear overweight, their health risks might go unnoticed by healthcare professionals who rely solely on BMI. The issue of misclassification extends beyond BMI. Historically, society has linked obesity with moral failures, such as gluttony and laziness. These metaphors hurt patients and make it harder for them to access proper care. Obesity is not just about overeating or inactivity. It involves complex factors like brain function, hormones, and the nervous system. Dr. Beverly Chang, an obesity specialist, emphasized that society and insurance companies have oversimplified obesity to mean too much fat. But the reality is far more intricate. Obesity's struggle with identity mirrors other diseases. Over time, the definitions of diseases like osteoporosis and type 2 diabetes have evolved based on new scientific insights. Osteoporosis, once considered a normal part of aging, is now treated as a disease due to advances in medical imaging and bone-strengthening medications. Similarly, some cancers are now redefined based on how tumors grow and spread. These shifts illustrate that diseases are not static. Their definitions change with new knowledge and societal shifts. Countries and organizations have also reached different conclusions on whether obesity should be classified as a disease. The AMA declared it a disease in 2013, despite its advisory council warning against using BMI as the sole diagnostic tool. The AMA argued that calling obesity a disease would legitimize it as a medical condition, help allocate resources, and reduce stigma. Some individuals, like Aditi Juneja, found relief in this new perspective, as it shifted the blame away from personal responsibility and helped them understand the deeper factors contributing to obesity. Other nations, like Denmark, have taken a different approach. Despite being the home of Novo Nordisk, the company behind popular obesity drugs, Denmark classifies obesity as a risk factor, not a disease. Danish experts argue that labeling it a disease could increase stigma in countries with robust public healthcare systems, where individuals already have access to necessary treatments. In the end, the debate over whether obesity is a disease or a risk factor is about more than just semantics. It influences how healthcare systems treat millions of people. While movements like health at every size and fat acceptance challenge the medicalization of obesity, experts agree that a better definition of the condition could lead to more effective treatments. To address this, Dr. Rubino has organized a commission to finally define clinical obesity. This group aims to provide a clearer diagnosis by examining how obesity affects the body organ by organ. Their findings could mark a turning point in understanding and treating obesity more effectively. By moving beyond outdated measures like BMI, the medical community may finally be able to resolve one of the most pressing health issues of our time.